Hi Jamil, I have your discharge paperwork and some printouts here for you. We're going to go over all this information before we send you home. It's kind of a lot, so if you have any questions, please stop me. While you were here, you came in for increased shortness of breath and wheezing. It was unrelieved by your Pro Air inhaler. You were diagnosed with asthma exacerbation. While you were here, we gave you an albuterol nebulizer treatment and Solumedrol, which relieved your symptoms. You currently aren't on any daily medications for your asthma, but you do have the Pro Air as needed. So a little bit about asthma. It's chronic swelling of the airways. However, it can be reversible either spontaneously or with treatment. The amount of swelling is variable. So sometimes your swelling is going to be down and sometimes there might be more swelling. And it's important to recognize what triggers more swelling with your asthma so you can prevent an attack or avoid an attack altogether. This is different from person to person. Different triggers that can increase your symptoms include allergens, certain drugs, food additives, respiratory infection, exercise, and cold, dry air. Air pollutants such as cigarette smoke, perfumes, and aerosol sprays are also major triggers. So you stated when you came in that your shortness of breath and wheezing began after smoking marijuana. Smoking marijuana, cigarettes, e-cigs, vapes, or secondhand smoke increases the swelling in your airways, making it even more challenging to breathe. So we do highly encourage you to stop smoking. I know your parents smoke as well. It's important to limit your exposure to secondhand smoke. I want you to think of your lungs like a balloon. When your asthma is controlled, it's a normal sized balloon. The neck or the mouthpiece is open. You're able to inflate and deflate without a problem. You have no symptoms. A trigger such as chemicals from smoking causes your airway to swell. So in this instance, rather than blowing up a regular balloon, you're trying to blow up one of those balloons they use for balloon animals without a pump. The opening to this type of balloon is much smaller, making it more difficult. It takes more effort and it wears you out in order to fill it up. So that's similar to what happens with your lungs. When a trigger causes the swelling, it makes everything smaller and tighter and makes it more difficult for air to come in and out. So this is why you experience the shortness of breath and wheezing after smoking. In a person with asthma, smoking is associated with a faster decline of lung function, more severe asthma, more frequent doctor visits, and your body doesn't respond as well to treatment. Smoking increases your risk of cancer, heart disease, stroke, and can lead to long-term lung issues like chronic obstructive pulmonary disease. And quitting can actually add about 10 years to your life. You're young. We want you to live a long, healthy life. I did print out some resources for you, whether it's counseling. There's also a text number that you can reach out to if you're more comfortable with that. So I will give that to you. There's just some resources and I hope you use them. We're sending you home with a prescription for prednisone. You're going to take 40 milligrams for 5 days. This medication will help decrease the swelling in your airways, making it easier for you to breathe. I included a printout about the medication, but I am going to highlight a few main points. You will want to take it after eating because it can cause your stomach to be upset. If you miss a dose, take it as soon as you remember. But if it's almost time for your next dose, we want you to call your doctor. We don't want you to take double or take extra doses to catch up. Some side effects of this medication could be sweating, headache, mood changes, increased heart rate, and increased appetite. You'll want to avoid alcohol, caffeine, aspirin, ibuprofen. The name brand for that is Motrin and Advil, and naproxen sodium, which is Aleve. So if you do get a headache with this med, you'd be okay taking acetaminophen, and the brand name is Tylenol. So you could take that as directed on the package if you do get a headache. Make sure you monitor yourself for signs of an allergic reaction. Stop taking it and contact your doctor right away if you get a skin rash, itching, or hives. If you notice swelling of your face, lips, tongue, or throat, that is an emergency. Make sure you call 911 right away. And then we are going to send you home with an asthma action plan. So think of it like a stoplight. There's a green, a yellow, and a red section. Green means you're good to go. You're not having any symptoms. There's no cough, there's no wheezing, no chest tightness or shortness of breath. You're able to do your usual activities without any problems. You're not on any daily medications currently, so you don't need to worry about this part of the plan. Yellow zone means your asthma is getting worse. Okay, you might have a cough or be wheezing, have chest tightness, shortness of breath. If you're waking up at night due to your asthma, that also is a yellow zone. You might be able to do some of your activities, but not all. When you're in this zone, you'll take your inhaler as prescribed by your doctor. Now the red zone, that's when you need to stop. That's a medical alert. If you're very short of breath, your inhaler didn't help you, you can't do your usual activities, or if your symptoms are the same or worse after 24 hours in the yellow zone, you want to contact your doctor right away. Go to the hospital or call an ambulance if you're in the red zone after 15 minutes and have not reached your doctor. Major danger signs to look out for include trouble walking and talking because of your shortness of breath, or if you start noticing a blue tint to your fingernails or your lips, that's a sign that you're not receiving enough oxygen. Okay, this is a medical emergency and you need to get to the hospital or call an ambulance right away. We do not want you driving yourself there. Make sure you have somebody take you or call paramedics and have them come get you. Okay, any questions about your action plan? Okay, you have your ProAir inhaler. Use that as previously prescribed. We also want you to follow up with pulmonology in 3 days or sooner if needed. I did highlight the provider's information right here for you. All right, we're going to give you that flu vaccine we talked about earlier. Do you have any questions for me? Okay, I'm going to go ahead and get your flu vaccine ready here. All right, sanitize. All right, so I'm going to prep my syringe. Got an 18 gauge here to draw up. I'm going to scrub for 30 seconds, 28, 29, 30, and let it dry. I'm going to do 1 ml of air. Inject above the fluid line. Okay, 1 ml. That will go in the sharps. Changing to a 25 gauge. So on the mannequin, I would scrub from in to out for 30 seconds. Now locate the acromion process. So the joint here, go 2 to 3 fingers below. And then make a V, and the bottom of my V will go mid-axillary line. And my injection will go right here. Okay, for this, I'm gonna scrub the skin pad for 30 seconds. Right, 29, 30. Let it dry. Inject. Out. And this will go in the sharps. All right, Jamil, we have you all set. When your ride gets here, I want you to push your call button and we will take you down so you can get home and get on your day.